次见你，一双迷人的眼睛，在我脑海里，你的身影挥散不去。握你的双手，感觉你的温柔，真的有点透不过气。你的天真，我想珍惜。看到你受委屈，我会伤心。只怕我自己会爱上你，不敢让自己靠得太近，怕我没什么能够给你。爱你也需要很大的勇气，只怕我自己会爱上你，也许有天会情不自禁，想念只让自己苦了自己。爱上你是我情非得已，难以忘记初次见你，一双迷人的眼睛，在我脑海里，你的身影挥散不去。握你的双手，感觉你的温柔，真的有点透不过气。你的天真，我想珍惜。看到你受委屈，我会伤心。只怕我自己会爱上你，不敢让自己靠得太近，怕我没什么能够给你。爱你也需要很大的勇气，只怕我自己会爱上你。也许有天
Naunsa naman pare? Nasaan na ninyo ang card?
Sim pare, I mailed na already yesterday pare.
How about today? Nasaan ang red card para today?
I swear to God, na-deliver na. Door to door yun, Orbs. For real.
Well, no. Good spread. Thank you so much.
虽然经常梦见你，还是毫无头绪。外面正在下着雨，今天是星期几 ？But I don't know 你去哪里？虽然不曾怀疑你，还是忐忑不定。谁是你的那个唯一？原谅我怀疑自己。我明白，我要的爱会把我宠坏，像一个小孩，只懂在你怀里怀爱。你要的爱不只是依赖，而像个大男孩，风吹又日晒，生活自由自在。
Hello, good day, Miss. How may I help you today?
Good day, Doc. Kanang ipa-check ang tanak ko ni ako ang Source bitaw sa kuhang arm. This went for about 2 weeks naman good. Tas wala gihapon siya nawala.
Really? Okay, move gamay sa camera para makita nako clearly, please.
Here, doc. Nasa sa ako ang lower arm.
Okay. This word does not seem worse romansad. Naakailain gipang bati aside ana?
Wala raman sad ko naghilanat doc or ubo or whatsoever. However, I noticed some changes bitaw sa kuhang appetite. Like kusog na kay kumukaon than usual ba?
This is kinda sensitive. So, nag-try na ka mag-pregnancy test, miss?
Joker ka, doc. Umagani ko'y uyab.
Anyway, did you feel na nag-blurry imo panan?
Or kanang dry imong throat per me?
Hala, yes, Jud, doc. Naka-experience ko ana, like, maglisod kog basa, sa, like, pag magbasa kog book, and then, sige, rasad kog inom og water these days ba?
Okay, so I'm kind of suspecting it's from your kidney or so. But we'll see. For now, I advise you to go to a laboratory and get your fluids examined there. CBC, urine, feces, fasting blood sugar test. So I will send you the referral later. So tapos, ipakita lang na sa clinic, okay? Come back once you get the results.
Okay, doc. Noted. Thank you kayo, doc.
Okay, thank you. Bye.
Hello, Miss Shangcai. Good day. So, kamusta man imong pagpa-laboratory the last time?
Good day, doc. Okay ra, doc. Na-cater ako sa clinic and then nabuhat ra sa namo tanan imuhang gipabuhat na laboratory test, doc. Nadawat ra nimo ang mga results?
Yes, Miss Sunshine, and I have scanned your test already. I am really sorry. So, I have a bad news for you. Are you ready for it?
Hello, doc. How bad? Tell me na, be.
Okay. So the test shows na you are on the early stage of diabetes. Your blood sugar level is really high. Your organs such as kidneys, eyes, and nerves are malfunctioning.
Diabetes? Unsa na, doc? Kadungog ko na term, pero wala ko kabalo kung unsa na siya nasakit. Asa nagikan?
Really? O sige, I will let you see this video para makahibaw ka kung unsa ng diabetes, okay?
Okay, doc.
Good morning, Mommy Jessa Soho.
Good morning, Mommy Kaladsharen, Davila. At magandang araw rin sa mga mommies na nanonood today.
Welcome sa ating show na patungkol sa ilaw ng tahanan ang Inamuka!
Inamuka!
Hay nako, Mami Jessa. Ngayon, may dala akong malungkot na balita. Kasi nga raw, si Mami Magdalena ay diabetic na.
Naku, baka sa sweetness lang ng asawa.
Hindi, totoo to. Narinig ko kagabi. Kaya nga, ang script natin ngayon ay patungkol sa blood glucose.
Oh, kaya pala. Kaya pala ngayong araw may dala kaming mga impormasyon upang mas maunawaan natin ang blood glucose at maiwasan maging diabetic ina.
Diabetic ina!
Blood glucose is the main sugar found in your blood. It comes from the food you eat and is your body's main source of energy. Your blood carries glucose to all of your body's cells to use for energy. That is why glucose is also termed as fuel, since it is the most important carbohydrate in the body to be converted as energy. Now let's talk about the brief history of blood glucose. In 1552 BC, the first known mention of diabetes symptoms was with Huaze, No, I'm not talking about Shiraz. Rather, I am talking about an Egyptian physician named Hisira, who documented frequent urination as a symptom of a mysterious disease that also caused emaciation. Also, around this time, ancient healers noted that ants seemed to be attracted to the urine of people who had this disease. In 1747, glucose was first isolated from raisins by Andreas Marggraf. In 1776, an English doctor named Matthew Dobson notices that blood serum tastes sweet. During 1878, the name glucose was coined by Jane Dumas from the Greek glykos means sugar or sweet, and the structure was discovered by Emil Fischer around the turn of the century. In 1960s, blood sugar test strips are used in doctor offices. In 1970, the first glucose meter was used. The straw sticks, but its precision and accuracy were poor. By the mid-1970s, the concept of patients using blood glucose data at home was contemplated. And lastly, in 1980, the dextrometer was launched, and this meter was used by the straw sticks along with a digital display. Now let's talk about when a blood glucose can rise or fall. So blood glucose can rise if you ate too much food such as a meal or snack with more carbohydrates than usual, not being active, not enough insulin, side effects from other medications, illnesses, since your body releases hormones to fight the illnesses, and those hormones could raise your blood glucose levels, stress, which can produce hormones that raise blood glucose levels, short or long-term pain such as a pain from a sunburn, since your body releases hormones that raise blood glucose levels, menstrual periods which causes changes in hormone levels, and lastly, dehydration. So blood glucose can fall if you eat not enough food such as a meal or a snack with a fewer carbohydrate than usual or a missed meal or snack. Alcohol, especially on an empty stomach, too much insulin or oral diabetes medications, side effects from other medications, more physical activity or exercise than usual, since physical activity makes your body more sensitive to insulin and can lower blood glucose. So what are the normal blood sugar levels? Usually, there are less than 100 milligrams per deciliter after not eating or fasting for at least 8 hours, and they are less than 140 milligrams per deciliter after 2 hours of eating. During the day, levels tend to be at their lowest just before meals. For most people without diabetes, blood sugar levels before meals hover around 70 to 80 milligrams per deciliters. For some people, 60 is normal, for others, 90. What's a low sugar level? It varies widely too. Many people's glucose won't ever fall below 60 even with prolonged fasting. When you diet or fast, the liver keeps your levels normal by turning fat and muscle into sugar. A few people's level may fall somewhat lower, just like mine. 60 may be normal for me. I don't feel any nausea or vomiting and all the headaches, but for others, 60 could be their lowest and their body couldn't handle it. So the levels of your blood glucose usually depends on your body.
So now let's go on with the types of diseases. So there are two types of diabetes. So first is the type 1 diabetes, in which your body does not make insulin. So your immune system attacks or destroys the cells in your pancreas that makes the insulin. So type 1 diabetes usually occurs in children or at young adults. So although it can appear at any age, people with type 1 diabetes needs to take insulin every day in order to live. While on the other hand, type 2 diabetes, in which the body does not make or use insulin well, it can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes usually occurs in middle age or older people. So now let's proceed with the diagnosis and types of tests. So there are two tests that can determine if you are diabetic or not. first is the fasting plasma glucose test, in which the doctors or we medtechs will test the blood sugar levels after fasting for 8 hours, and if it's higher than 126 milligrams per deciliter. Next is the oral glucose tolerance test. So after fasting for 8 hours, you will get a special sugary drink. So 2 hours later, if your sugar higher than 200, so automatically you will be diagnosed as a positive diabetic patient. So next is what are the possible treatments to the disease if available? So technically speaking, there is no cure to the disease, but we can minimize it or we can control it by first drinking more water. So water can actually help you. Reduce dehydration, and also helps you to remove excess sugar from your blood through urine. So next is exercise more. So working out can actually lower down your blood sugar, but there are also exercises that can increase your blood sugar level. Next is changing your eating habits. So this is the most important one. So you may need to meet a dietitian to change the amount and the types of food you eat. So next is switch medications. So your doctor might change the amount, the timing, and the type of diabetes medication you take. So it is best to consult your doctor before changing it. If you have any type 2 diabetes, your blood sugar is more than 250 milligram per deciliter. So now let's proceed on the recent discoveries. It is from the University East Anglia. So a medication originally used for patients with diabetes, and its first step is to help people with heart failure and could revolutionize the treatment. So early research have shown that SGLT2 inhibitors could actually help around half of heart failure patients with condition known as reduction ejection fraction.
Ngayon mga mamshis, alam na natin kung ano ba talaga ang mga magagandang maidudulot at masamang maidudulot ng asukal pag nasobrahan.
Kaya reminder sa mga lahat ng mommies, maganda ho ang asukal sa buong katawan, lalo na't kailangan ito para sa normal body functioning. Ngunit, pag ito'y nasobrahan, ay nako, dyan tayo magkakaproblema.
Ika nga nila, laughter is the best medicine. Pero pag ikaw ay diabetic na, wala nang atrasan, bumili ka na lang ng insulin. Kaya hinay-hinay sa sugar upang hindi maging diabetic na!
Diabetic na! Ito nga ulit ang show para sa mga ilaw ng tahanan, ang Inamuka!
Wow, mo dito ang blood sugar, Doc? Grabe, daghan kikog na learn. I didn't know nga mo dito ang rason nga nung magka-diabetes ang isa ka tao.
Yes, ingana ka sensitive ang body. Now, I wonder if this is hereditary or you just developed it.
Really, Doc? Wala kong ma-recall na naay ingana nga sakit nga diabetes sa amuhang family from both sides.
Oh, so then you must have developed it, Jude. Do you eat a lot of carbs or like sweets?
Yes, Doc. Lately lang, Jude. It's because of the bully F4 manggod, oy. My threats were always about eating sugar or any tamis na mga pagkaon. Tas later on, wag ni-abduct na ko ang body, tas permin ako mag-crave of other carbs like rice, sweets, and even bread. I can't help myself but eat it magyud.
F4? Wow, you must be the new victim.
Kailan kanila, Doc?
Sad to say, pero yes, I had a lot of patients na sila pod ang reason nga nung nagkasakit sila.
Ay, sa mukha jud ani nila, oy. Daghan na kay sila naapektuhan rod mga gwapo.
Alright, so for now, resetahan ka na ako sa mga tambals na lang to regulate your sugar level. And also, have your personal testing kit of glucometer para you can check your sugar daily. Please, minimize your unhealthy lifestyle. And ayaw na patuuan ng F4, mga jeje mo na gana sila. Let's have our regular check-up every 3 months para ma-check natin yung progress, okay?
Okay, Doc. Thank you kaayo, Doc. Daghan kay kog information na learn gikan sa imong video. I'll take care of myself better this time around na gyud. Thank you,
Okay, Miss
Doc.
Shangcai, you are welcome.
Thank
Bye.
you. Bye.
Oh baby 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 my baby baby 我绝不能失去你，你手心你声音还占领我的心，怎能忘记？想你就像是呼吸。Oh baby baby my baby baby 我绝不能失去你，不管你在哪里，我一定会找到你。
Yo pare, our spy totals na wala na raw si Sanchez Gabuat sa ato red card.
How true, pare? Gosh, wasin gusto dyan siya mabagsak ni Sam.
Tawagon na to, pare. She needs more punishment para matauhan.
Yeah, let's do that, pare. What the? Unsa naman ni? Nganong nalik ni?
Yo, chill bro. Unsa di ay na?
Damn! Unsay chill, oy. It's all over social media na. GG na tayo, pare. It's over na.
Ang unsa lagi na, pre.
He love me, he give me all his money. That Gucci Prada comfy, my sugar daddy. He love me, he give me all his money. That Gucci Prada comfy, my sugar daddy. He love me, he put no one above me. These bitches wanna judge me, but I don't care. He love me, he give me all his money. That Gucci Prada comfy, my sugar daddy. He love me, he put no one above me. These bitches wanna judge me, but I don't care. If he's paying me back, I'll take the oysters. I'm saying insane. I got some pointers. My baby is my employer. My baby knows how to spoil her.
1, 2, 3, go.
Wow, mo dito ang blood sugar, Doc. Daghan kay kog na learn by. Actually, I didn't know nga mo di ay